So we've got three different types of degrees burns, right? First degree, second degree, third degree. But we've really only got two categories, minor burns, major burns. So what falls into what category? Well, it's a no-brainer. First degree burns are classified as minor burns, right? And it's a no-brainer. Third degree burns, major burns. But what are second degree burns? Well, the answer is it depends. Because a second degree burn is typically classified as a minor burn. However, if any of the following exceptions exist, it would be classified as a major burn. These exceptions are a burn that is over 3 inches in diameter on the body, or a burn that is on any sensitive areas with a lot of nerve endings, such as hands, feet, head, face, or genital area. Any of those areas, if you get a burn, it's considered a second degree burn is considered a major burn. Now, if you have a minor burn, this is something that you can treat at home. Typically, what you want to use is cool, drinkable water. Now, we say cool, drinkable because what we're implying is that you don't want something that you wouldn't trust, like maybe river water or something like that might have a lot of parasites or other disease type things in it. You want to make sure that it's something you could drink safely, because otherwise, if you add water that's got any of those parasites or anything in it, you can just create infection on an open wound. So you want to use water that is cool and drinkable. So if it's something you could drink, you could use it to pour over the wound. This is the most effective way to treat minor burns. Now, obviously, you can use additional items such as aloe, which is great for healing burns. You could also use acetaminophen or other over-the-counter products to help ease the pain. But cool, drinkable water is the ideal way to treat a minor burn. Now, some people would say, I got a better idea. How about if I use some ice? Never use ice on a burn. Why not? Well, there's a couple different reasons. Number one, you could cause it to stick to the burn. If you've ever done that little trick in the freezer where you got a little moisture on your finger and you touch some ice and it sticks, yeah, you could do that with an open wound. If it's oozing at all, you could cause it to stick. But more importantly, ice on a burn can actually create frostbite, which now you've got a whole other set of problems. So never use ice directly to treat a burn. Cool, drinkable water is the ticket. Now, what about a major burn? If you've got a major burn, you want to immediately call 911 or seek prompt emergency medical attention. You never, ever want to attempt to treat a major burn on your own. Leave that for the medical professionals. The best you can do is if you've got 911 on the way, maybe you can lay the patient down. You can elevate their feet above their heart to kind of help slow the blood flow and keep things from getting more aggravated in the burn site. You also could try to make sure that their clothing is not stuck to the burn. But you never want to remove the clothing off there. Especially if it is stuck, you don't want to remove it because that can create additional infection problems. But try to gently make sure that around it is not sticking. And that's about all you can do for a major burn. This is something that has to be treated by a medical professional.